Hello, my name is Madia Evans, and I prepared a PowerPoint presentation today. However, I do not feel that you're going to be able to read my slides in this video, so I will be sending a copy so that you can refer back to the slides while watching my video. And the disease that I chose to present on today is trichomoniasis. What is trichomoniasis, or more commonly known as trich? Well, trich is an STD, a sexually transmitted disease, caused by a protozoan parasite known as T. vaginalis. T. vaginalis is not a free-living organism, which means that it requires a host site, such as a human or an animal. Trich affects the genitalia of both men and women. The organism itself lives in the urinary tract in men and the reproductive tract in women. T. vaginalis is resistant in nature and requires a more basic pH to be successful. So for example, the vagina has an acidic pH, which is not a good place for this organism to live. So when the vagina, the pH is knocked off and becomes more basic, it becomes the perfect breeding ground for this parasite to flourish. So signs and symptoms of trich include, in men, you have itching and irritation and burning during urination in the penis. You also have a discharge from the penis. In women, you have irritation, redness, soreness, itching, burning. There's also a discharge that varies in color from clear, cloudy, white, yellow, and green. And there's also an unusual fishy smell. There's also pain during sex while being infected with this disease. Trich can, even though it does have symptoms, there are people who don't experience any symptoms. Actually, about 70% of people that have contracted trich did not have symptoms, and the symptoms come and go. Complications. There are some complications of having trich that can affect you long term or in the future. It can increase your risk of contracting HIV, or if you are already HIV positive, then passing it to a partner. It can also increase the risk of cervical cancer. Another risk of trich is premature births in pregnant women and a low birth weight for the baby. So, occurrence. Trich is the most commonly curable STD, more common than chlamydia and gonorrhea. About 3.7 million people in the U.S. have trich, and that's including both men and women. It's estimated about 2.3 million women between the ages of 14 to 49 will have trich. Older women are more likely to contract this disease more so than younger women. It is not a nationally reportable STD, however. So even though it's very common, it's not very prevalent in society. Not too many people talk about it as much as you hear about chlamydia and gonorrhea. So how do you get trich? Well, like I said, trich is an STD. It is sexually transmitted. So you get it through sex, including vaginal sex, oral sex, anal sex. The most common is vaginal intercourse. You'll see the disease being passed from men to women, women to men, and even women to women. It can be passed from vagina to vagina. However, it cannot be passed from a man to another man. That you don't really see that much. Another way to transmit trich, which is very, very rare but possible, is through damp clothing and damp towels. So once you get trich, how do you treat this infection? Like most bacterial infections or other infections, you use antibiotics. The most common antibiotic used is metronidazole. It is a very broad spectrum antibiotic. It is used to kill multiple infections, multiple bacteria, and it's a pill that you take. How do you prevent this disease? How do I stop myself from being able to contract this infection? Just like any other STD, there's only one way to 100% make sure you do not contract any STD, including trich, and that is abstinence. To abstain from sexual intercourse, including oral sex, anal sex, and vaginal sex. But if you are sexually active and you still want to know how to protect yourself, there are other ways, such as using condoms, limiting your number of partners, getting tested regularly, making sure your partner gets tested regularly. Yeah, and staying in a monogamous relationship will always help you to protect yourself from these diseases. And that is the end of my presentation. Thank you.